would I? Oh, this meeting is being recorded. Yeah.
Because if you can have up to 3 people in a room without it eating into 40 minutes.
Oh, that's handy. I didn't know that.
Yeah, I read it somewhere. Hopefully that's accurate. Hi, Keith.
Oh, yeah.
Hello.
Yeah, we'd let you in first so you can get comfy. You're comfy.
How does it feel, Keith, not to be operating in the Zoom?
Well, it's one less set of buttons to press, isn't it?
Yes, exactly. It's got one thing less for you to worry about.
I was on a call the other day with Hampshire Hospital, asked for members of the public who were interested in joining a program of meetings about the redevelopment of the hospitals.
Mm-hmm.
So I said, all right, I'll come along and see what I go. You know, it's quite interesting, but it was the lady running it was really sharp. You know, every time a hand went up, she immediately said, "Right, you're next." You know,
oh, really?
Yeah, practice.
Yeah. Well, I suppose if you've got a lot of people, you've got to be really.
That's right. Yeah. There's a networking thing I go on where you get a couple hundred people, and then every 5 minutes you get put in a breakout room with 2 others. You know, and you really have to be disciplined, because every time you go into the breakout room, you have to unmute yourself, and then you have to remember not to waffle on. You know.
Oh dear. I'd be hopeless with that. Absolutely hopeless.
Yeah, you do get a few people who just go on and on, and you think, oh God, here we go.
Yeah.
Anyway.
Yeah. Well, we haven't got that much time, so
yes.
So I think we need to be quite smart as far as Claire's concerned, because it's not fair for her to give up her whole lunchtime.
No. I'm just thinking about the agenda. We could probably skip over number 3, because we've already agreed that the surgery just said they haven't got time for anything at the moment. So we can decide to get together separately ourselves. Yeah.
The carers one is 30 seconds.
Yes.
That doesn't need any time at all.
Yeah. Okay.
But yeah, it'd be interesting to see what Dr. Ward's data analysis is.
I'm confused. It's very strange, because this was Mike at the last NHCCG meeting, and he just mentioned it afterwards. Problem was, he couldn't remember who'd presented it, or indeed what it was about.
Obviously paying a lot of attention then.
I know, and I just emailed everybody, and Annette Rushmere came back and said that was me. I thought, oh, okay, because Mike said it was a bloke from Chinham, but anyway. And I said, do you know what it's about? And she just said, ask Dr. Ward.
Right.
And I thought, okay.
Yeah. Well, we don't get the chance to talk to her now, so.
No, but I mean, the odd thing is, we don't know what it's about, and also it seems that everybody else in the PCN group, including the PPGs, do.
Well, that doesn't seem quite right, does it?
I'm sure it's cock up rather than conspiracy. Always.
Very likely. Very likely.
You know the theory,
indeed.
don't you?
Absolutely, yeah. So I was just I'm just having a quick look at the.
So Claire's updates. We can go through the matters arising in a matter of a minute, probably.
Yeah, absolutely.
I think Claire's update will probably be short.
Yeah, the thing about the fate.
Yeah.
I'm actually wondering, is it worth it?
It's helpful. I don't know. We did it a couple of times at the coffee morning, and that was actually quite useful. So. Yes,
but the problem is, we don't really know whether the fate will go ahead 100%.
No, indeed.
There's always going to be that. If it's pouring with rain, we don't want an information stall outside. That would be good. And we've got to have something to inform people. Yes. And I think we need a separate meeting for that. Because,
fine. Well, let's park that one as well. It's really about the moment about asking everybody if they're willing to help.
Yes.
Now we can help out, because we've got a small gazebo.
Yeah.
Open-sided. And I'll twist Antonia's arm to borrow one of our folding tables as well. So, and also we've got a laminator and a load of A3 lamination pouches, which I actually bought for the surgery when they were doing the redevelopment and needed signs everywhere. So, we can actually produce simple stuff quite quickly.
Oh, that's handy. Yeah. So I don't think we need to overly worry about the fate at the moment.
We just need to make sure that there's a space, I think, is all we need, and a couple of people to sit behind the table.
Yeah, because Jan and I are thinking of having an information store for the hub, and we could possibly we could go together.
Yes, absolutely. Yes.
So I think that might help all round. And then we've got, because there are a couple of other things that are going on, that Jane's involved in 2 or 3 things, I'm involved in 2 or 3 things. So we'll all be there, and we can just sort of support each other. I think I'm just going to have to draw my curtain because I'm looking.
Yes, you suddenly got very bright. Yes.
Photography, that's called high key, but
yeah.
Right.
So.
Right, just to let you know that Alex and Julia are in the waiting room, but no one else is.
Well,
and I'm waiting for delivery from Amazon that's going to come slap bang in the middle of this meeting, because that's what happens. Yes. So apologies.
Well, it's 1 o'clock, and we did say start promptly at 1.
Hang on, I'll let them in.
But we need Claire.
Claire's not there, no. It's like someone's just. Right, Jane's just arrived. I need to open the door. Shall I admit them now?
Yeah. Yes.
Yeah. Go on then. So, Alex and Julia.
Yeah.
Right. And we have a black chair. Who's running the meeting at the moment?
Mastermind.
Yes, absolutely. Well, I found it really helpful when I did the meeting last time to have Jan do this Zoom meeting, because I didn't have to worry. I just did the talking.
Yeah, exactly.
And she did all the technical stuff. And because she does, it's part of her job. She does it all the time.
Yeah,
so it wasn't any big deal to her.
Yeah.
So I thought maybe we'll try. If it doesn't work, it doesn't work. But I think on the whole it does. Hello, Alex.
On mute.
You're muted.
Muted, sorry. Yeah.
Hey.
Yeah, right.
That's better. You're muted as well, Jane.
Yes.
Hello, Julia.
Hello.
Right, that's okay. Right, who are we waiting for?
No one
waiting for
Claire.
Mike hasn't said anything.
Oh yeah, I forgot about Mike. Jackie?
And Jackie. Oh, Jackie can't make it as of about a day or so ago. So.
Okay.
So really, it's Claire. I mean, if Mike comes, it's not. If he doesn't, it's not the end of the world.
But he works, doesn't he?
I think so, yeah. But he's also. I spoke to him the other day, and he said, "Yes, I think I'm coming to the end of my statutory period."
Oh, really? Oh, that's a shame.
Right. Tell a lie. Right, Claire. Oh dear.
Right. Jane, you need to unmute yourself. Nearly. Nope. Jane doesn't want to be heard.
That's it.
Mike.
Hey.
Made it.
Hello, Mike.
Hey. Hi, Mike.
Nearly there.
Oh, is Mike there?
Yes.
Oh, excellent. I can't see you. Oh, yes, I can. Having your lunch break again.
No, I've just finished that. The lunch bit. Yes.
Okay, Mike, before Claire arrives, this business about Dr. Ward's analysis stuff, do you have any more idea of what it was about?
Oh, she's done some analysis of how patients have varied, or comparison, or some kind of thing, because of the changes in how they were delivering care to patients. I think it was that kind of thing, and it came up in the context of a discussion about the questions that you received, that they wanted our feedback on. And the guy who's I think the chair of the Chinham PPG said what a good presentation she'd done.
This is interesting, you see, because I asked, I don't know if you saw, I emailed everybody on that list, and Annette Rushmere came back and said that was me. And I said, okay, do you have any information? Do you have any information on what it's about? And she just replied, ask Dr. Ward.
All right. Okay.
That's it. So she basically, for some reason, wasn't prepared to even tell me what it was about.
How very strange.
It is odd, isn't it?
Yes.
Okay. I mean, I know it's burning the house down, but it's just sort of, you think, well, it seems that everyone else in the PCN knows about this, but Cliff PPG doesn't.
It wasn't anything to do with that link that I sent you this morning, Keith, that David sent. I
don't know. Do you know about that, Mike?
No.
This is the David Canham some little while ago. I can't remember what he put something on Facebook about a national GP patient survey. It's actually, the website is gp-patient.co.uk. I mean, I had a look at it, Sue, and it's, it doesn't really tell you a hell of a lot, does it?
No.
Afterwards, I thought, this is a sort of David thing. He likes surveys and numbers.
Well, the way it was kind of passed over to me was that, or explained to me, was that this was something that she'd done on her own initiative, and it was kind of well received. But
well, fine. I mean, if there's anything in there, if there's anything in there that will help us help them, then for God's sakes, can we know about it, please?
Yeah, I know.
I'm sure, as I said to Sue, I'm sure it's cock up rather than conspiracy, but it would be nice to know. Right, what we're going to do about Claire?
I don't know.
Well,
it's 5 past.
Yeah.
So it might be. Can you contact her?
Well, all I can do is ring the surgery.
All right.
Is there anything that we can discuss that doesn't need Claire's input?
Yeah, there are a couple of things, I think.
Yeah. So we would, before you guys arrived, we were already just talking about it. Item 3 on the agenda, activities. The surgery has already said they can't support anything for the moment, so there's no need for us to bother them with that item at all at the moment. So we can perhaps go off somewhere else and talk about that. And
are they supporting the weekly walk? Are they actively supposedly telling patients that this is available and prescribing it, which is what they were supposed to be doing?
I guarantee not. By the way, we had 0 punters on Wednesday.
That was going to be the follow-up question.
Yeah. Now, if you remember from last time, Mike, it took a long time.
Oh, it did. But that was in part because the frontline staff hadn't been informed about it.
And what we did was we gave them a stack of the little flyers.
Which you produced, yes.
Note for minutes, must print out lots of those little flyers.
But
then they just handed them out. So if you
we stuck them on reception. We stuck them on reception.
But people don't go to the surgery now.
Oh God. That's a problem.
But they will be having diabetic reviews and reviews of that kind. I mean, I haven't had mine yet.
It'll be the best we can do.
And that's basically getting whatever her name is, Margaret, and the other.
Well, I'll tell you what I'll do. Again, note for minutes. I will ask Margaret because she's next door.
Right.
Yes.
Yeah.
Can we not put it on Facebook? Bramley and Sherbinston on Facebook.
Oh, it already has been.
Yeah. Can we not put the leaflet in the dispensary? People...
Yeah. Well, yes, absolutely.
Dispensary might be better.
Yeah. Okay.
I mean,
it's going to be difficult.
Yeah.
And I mean, I think also coming into summer when everybody's going away, so we'll have to see how we go. I mean, it was very difficult the last time. I think we got 11 was the maximum we ever got, and half of those are PPG members.
Yeah, and the thing is, there's a women's walking group on a Tuesday evening.
Yeah, I know. Yeah. Hi, Claire.
Yeah.
Hello, I do apologise. I got caught. I need to have my tin hat on when I run through the surgery at the minute. I got caught, so I do apologise. I very much do, because I appreciate it's your time.
Note for the minutes, PPG to buy Claire some armour.
Absolutely, it's running out. It's wearing out. Need some more. Oh Lord, I made it though.
Guy I used to work for had a really simple solution to being interrupted. He had a red beanie hat, which was the thinking hat.
Really?
And whenever he had that on, everybody knew he was not to be interrupted.
Really?
Oh, nice one.
I might have to employ that idea.
I like that.
Yeah. Right, shall we get going then?
Yes.
Right. Let's just start out of order. eConsult. Claire, do you think it would be worth our while publicising the fact that it's only open for certain hours?
Yes, I think so. I think it might help, and I think it'll kind of lessen the frustration with people if they feel that
exactly.
I think it's all to the good. So I can't see that there'd be any problem with that. So thank you.
Simple thing we can do then.
Yeah, absolutely.
So this is one for Billy, really. The link to the new PPG webpage from the surgery site, you have to click through 3 rather obscure links to get to it.
Okay.
It just needs to be
tidied up a bit.
On the front page, patient participation group, bang. Yeah.
Sorry, can I just quickly go back to eConsult? When I tried to consult eConsult, it said on the website, during COVID, this is not available. So I had to phone the surgery.
Really?
That is really interesting, because I emailed Keith, didn't I, Keith?
Yeah.
I said, what's going on here? Because I was checking the website, and exactly the same thing came up. There was no eConsult. It's almost as if it reverted back to probably a year ago. It was most peculiar.
I'm looking at it right now.
I emailed Keith, and then I rebooted it, or refreshed the page rather, and then it all came up again. But yeah, my initial look, it didn't have it at all.
Okay, looking at it right now, there is a yellow banner across the top, which amongst other things says, do not use eConsult to contact your surgery about the COVID vaccine. But it doesn't say anything about it, but everything else is still working.
That's fine.
Or whether it sits on my computer from way back, and as you say, so you have to refresh the page.
Yeah.
But would people know that?
Well, I check the website quite regularly just to make sure that it's all up to date. And I was quite taken aback. I thought, oh my goodness, it's all changed.
Yeah, absolutely. Right. That's very odd. I'm just going to is anybody on it again now?
I'm actually on it now.
For me,
yeah. I want to ask my commission.
Yeah, I can see it. It's absolutely fine.
Yeah.
Get started. You just click straight into it.
Yep.
No, it was definitely a blip.
All right. Well, let's all keep an eye on that. Yeah.
Yeah.
It may well be something to do with the current website system, which leads me to another question. Are there any further thoughts on changing to footfall across the PCN, Claire? Probably not.
I think there will be. But not at the moment. We've got 2 big meetings coming up for PCN, which is the first one is for partners and practice managers, and the second one a little bit later on is to do with just general bits and pieces. I think it's kind of been put to one side at the minute, like a lot of things. But I think we will revisit it at some point. I just need to get together with Graham, maybe.
It certainly seems a lot better. Okay, all right. Another one for Billy is that, we had those mental health links.
Yeah.
They're on Bramley Hub, but not the surgery website.
Okay. I had a quick look, and I know that there's some. What specific mental health links were they, Keith?
There was a PDF, a live PDF document that came out from, I can't remember from where.
Oh, right. Okay. Yeah. Yes, I think I know the one.
That one, with about a dozen different. It was slightly odd because you actually had to download the document and then you could follow the links, which seems like a weird way of doing it. But
didn't that one have dates on it, though, specific dates on it that people could attend? Because wasn't that for the Mental Health Awareness Week?
No.
Or am I talking about something else?
You're talking about something else, yeah. Oh dear.
No, the idea was that it's mobile friendly, and in order for it to be mobile friendly, it has to be that PDF.
Oh, of course, yeah.
If you use it on a laptop, it's not live, but it is on a mobile phone.
Okay. So that's just another one for Bill to kind of organise.
So it's on. Jan's got it on the Bramley Hub website under mental health resources.
And I think Jan actually emailed it to Billy.
Yeah.
She may well have done.
Yeah.
I do know that in actual fact, I haven't had Billy for a couple of weeks, and she only came back this week.
Fair enough.
Okay,
well, let's
yeah.
I know she struggles to make any changes.
Yeah, well, the interesting thing, the thing that we've been up against is the fact that I took a week off, then she was sadly off for 2 weeks. There's lots of things going on for her, so we've literally just had this week, but we've been up to our eyes in,
of course.
all the usual things.
The day job, yeah. Which leads us neatly on to update from surgery and dispensary.
Okay. Well, the biggest update is that Dr. Archer has actually gone on maternity leave as from today.
Oh dear.
So yes, yes, I know, bless her. So yeah, she's definitely ready to go. I think needs a bit of rest now before baby arrives. So we say goodbye to her today. So she'll be off for about a year. We welcome Dr. Hayward. We haven't actually put this out to the wider patient group yet, but we've got Dr. Abigail Hayward joining us as from mid-August. So that's kind of to fill in gaps, obviously, with Diana obviously having gone, but also to kind of cover maternity. We do have 2 locums with us at the moment, which I'm sure you're aware of. One is Dr. Hannah Terafenko, and the other is Dr. Shan Malaya. So there are locum GPs. They're picking up a lot of routine clinics, so not necessarily the duty, but more routine clinics. So they're with us at the minute. We've got a lot of younger people around at the moment, mainly offspring of various staff members to help over the one of which is my daughter. So get them working. So they've either finished their GCSEs or their A-levels or whatever, and they've just come in to help out in the reception and dispensary areas.
Oh, good idea,
right up until they go back to college. So all the extra help is good, and I think it's quite nice to have a few little young faces around and about. And they're all keen and eager, so that's great. Sorry, did somebody want to say something? No. Hannah, our receptionist, had her baby at long last. She had a little boy. COVID changes as such. Obviously, moving on to COVID, things will be changing as from the 19th, but not necessarily within the practice as such. And I think that came across, and that was quite evident in the post that I just sent through to you this morning, Kate.
Jan's pushed that out.
Thank you, Jan. I think, obviously from our point of view, we will be wearing masks for the foreseeable future. There is there's no direction to say that we won't be. Doctors will still be wearing PPE. Patients will still be expected to wear masks when they come into the surgery and using the hand sanitizers. And it's just, we will be maintaining that kind of social distance within the surgery as well, for time to come. The Delta variant is still out there. There's lots of different variants that will be coming through. So as far as it depends upon the surgery, things will be largely unchanged, I'm afraid. But that's about it. Hampshire Court Hotel, obviously, I did notice that was actually on the Bramley Hub page. Still have the details for the Hampshire Court, so we might need to just erase that and take that off.
If you wouldn't mind, Jan, Okay.
And then maybe if we can add in Jameson House, obviously going forward. I sent you the document with regards to the first vaccinations and people being able to have a bit of a walk-in now and going to get there, and that's all
we publicised the walk-in dates.
Brilliant. Lovely. So that's kind of updates as regards surgery really at the moment. I'm trying to think if there's anything else. I don't think there is at the minute. If there is, through.
All right. Okay. Something came to my mind just then, but I've forgotten what it was. So. Right. Before you arrived, Claire, we thought we'd skip over item 3 because we know full well that you guys aren't able to support any new things at the moment. So we'll just go away and chew them over.
Can I ask one question? Yes. So the diet sessions, which was the low carb diet thing. On the website for the surgery, it's still saying, well, from 2020, it's the enrolment in the classes, but they're still, as far as I know, unlikely to be online. So we could update that. But is it, when I did it, it was being supported by the surgery to the extent that blood tests were done at the beginning and blood tests were done at the end, and that was showing the, the results of the program. So is that still available to patients of the surgeries? If so, we need to be able to say that.
Yeah, absolutely. No, that's fine, and that could be publicised as well.
That is still available. Okay. Yeah. All right. Well, I'll put a little note together on that, if that's okay, sure. And then we'll see where that goes.
Brilliant. Thanks. Yeah, lovely. Thank you.
Margaret can do 100 blood tests an hour.
She's phenomenal, is that lady? I wouldn't put it past her,
And furthermore, nobody would dare to faint.
No, absolutely not. No, not in Margaret's presence.
As an aside, I can't remember where it was, but apparently they've had since they've dropped the under 30s for COVID, they're getting a lot more fainters.
Yes. Yes.
And
I read that today.
And somebody said, and it's the young lad with tattoos are the worst.
You couldn't write it.
Antonia years ago did a bit of work for a while for the blood transfusion service in Oxford, and she said the worst of all was the inmates of an open prison who went down like flies.
Oh gosh.
Yeah, it's always the it's always the rich ones, isn't it?
Yeah. Right, move on. This is a mystery, Claire. So
okay.
Mike forwarded this to me. At the last CCG PPG meeting, there was some mention, discussion of some patient data analysis that Dr. Ward had done, which everybody, I wasn't on this, Mike was, which everybody agreed was terribly useful. So I emailed back and said, well, what is this? We don't know. And I got a reply from Annette Rushmere, who said, that was me, asked Dr. Ward, but didn't tell me anything about what it was.
Oh, okay.
So she may, so the guy who I heard it from at the meeting was the guy who I think may have been the chair of the Chinham surgery,
yes,
PPG, yes. And of course, Annette may be saying it was her who mentioned about the work that Dr. Ward had done, which was some comparative analysis of the patients that we've been seeing, or she specifically, it wasn't the practice have been seeing, and it seems to have been shared with PCN, and they were saying it was very good. So I was just wondering whether we'd have an opportunity as a PPG to have a look at it.
What seems to be the case is that Whitewater and Chinham PPGs have had a look at this and are thinking it might be useful, but we don't even know what's in it.
It's only one of our GPs as well.
Yeah, exactly. That's it. We didn't know it exists, and we have no idea what it's about. So could you perhaps, if you run into her in the corridor,
absolutely.
ask her to tell us.
Yeah, it would be nice, wouldn't it?
If she can.
Because it's our home team.
Exactly. Yeah. Yes. It's just one of those things. It's obviously just
Sure. No problem.
Minor detail got forgotten. Righty ho. Carers group then next on the list.
I spoke to Billy and she said that she'd spoken to Claire and Dr. Ward, and that I was going to give a presentation at some point, and that's as far as it's got.
Great. Okay. Yeah. I shall move forward with that one then. That's an action for me, just to get that all organised.
Yeah. I think she said it was about meeting with the partners because they seem quite interested.
Yeah, absolutely.
And she said, can you do a PowerPoint presentation or something of what I was proposing?
Great, lovely.
And then we'll see what happens.
Okay, I'll have a chat with Dr. Ward. She's away for the next couple of weeks. Actually, she's on leave now. But I'll pick that up on her return, and we'll just get to see if I can kind of push that forward a little bit.
Okay.
Yeah. All right.
We've just had a 10-minute warning.
Okay, right. Well, we may have to log back in again. Next one. This was it you, Sue? Somebody said communications on a health and wellbeing coach. Yeah.
Yeah. a friend of mine had an unsolicited text. Well, she thought it was unsolicited anyhow, saying that she was being diagnosed as pre-diabetic, which was like 2 years ago, and being invited on this Liz LaPlace course, and to contact Andy. And she was a bit miffed. She didn't know who Liz LaPlace was. She didn't know who Andy was. And when she went to look it up on the website, there's no mention of Andy. She didn't know who he was, what it was about, or anything. So I think her view was, if it had been clearer, she wouldn't have been so annoyed about it, and thinks that, you know, perhaps his presence ought to be on our website if he is going to be contacting people, and what his role is. That was all.
And we certainly ought to perhaps publicise it around a bit, so people at least, you know, have had a chance to know about it.
Okay.
It comes across spam, doesn't it?
Yeah.
Well, yeah, because she wanted to know. She said, "Well, how did he get my name? How did he know?" She hasn't had, she should have, obviously, because of COVID, she hasn't had a blood test for 2 years, and didn't know why that had suddenly popped up, inviting her to go on the course that Mike goes on. So she was a bit.
It's very odd. In order for me to kind of check that one out, Sue, would you be able to just forward me her details? Do you know her name and everything else?
Oh yeah.
Just send it through to me outside of the meeting, and then I can just have a look into it and just find out exactly what went wrong.
Yeah. And you know, in theory, it was okay to do it, but it was, she didn't think it was the right way to communicate.
No, absolutely not. And I just want to kind of know. I need to have an understanding as to how that happens, really. Yeah.
Yeah, it needs to have some sort of official stamp on it, doesn't it? Hello, this is Andy from blah blah blah.
Absolutely.
Our record show and so on.
Exactly. Yeah, he's part of the PCN. He's a health and wellbeing coach. But I think, you know, with some of these PCN bods, because they're not employed by us directly, sometimes it's like, well, what's their processes, what's their procedures? So I think for me, I need to understand how that communication went out, so that I can then address it within the surgery and maybe say, well, this is how we do things here. This is how.
All right.
No worries.
Sorry?
I just said no worries. I'll sort that out.
Right. So next one. I mean, I don't suppose we've got anywhere with this. The 8-week prescription idea.
I haven't got anywhere with it, Keith. I do hold my hands up. Just it's not.
Well, it's interesting. I know some surgeries up and down the country for some types of medications will give you up to a year's supply.
Yeah.
So it's not a standard national standard. It's perfectly understandable. If you're doling out Valium or something, you don't want to give 6 months worth. But you know, for something like I'm on calcium tablets. You know, frankly, I'm going to stick them on the cupboard and have a year's supply there.
Yeah.
So anyway, just a thought.
Okay.
Sorry.
But interestingly, my repeat prescription from last month, I opened the bag and suddenly found 2 months supply, which I hadn't requested. So, which is absolutely fine, because I mean that's really useful, because it means I've got less trips to the surgery. But I just suddenly ended up with 2 months supply.
Okay.
And the corollary to that also is the text alerts from dispensary are best described as extremely random.
Right.
I personally have never had one.
Right.
I'm not alone. You know, and I sometimes think, it's a week and a half now. I haven't heard anything. I better go and have a look.
Oh, okay.
But they have improved.
Oh, good. All right.
If you get them.
Previously, sometimes you did get a notification, sometimes not. But recently, with us, it has improved.
Good. All right. Well, I'll give that feedback to the girls, and then to see how we can kind of tidy that up even further, Alex. Thank you.
It may depend on who's doing it.
Yeah.
And the timing could be a bit odd, because I think I got the last one sort of like 7 o'clock in the evening on a Friday, which must have mean the medication was available on the Friday. But if I wanted it, I wouldn't have known until it was too late to get it, if you see what I mean. So, so maybe a timing switch or whatever on that.
Yeah, sure.
It'll certainly help, because, of course, it'll stop people like me turning up and discovering it's not ready yet, you know.
Yeah, and with patient frustration as well.
Exactly, yes. And we certainly, as we know, we need to sort that one out. Right. Next bit, we're not going to bother you with at all, Claire. We're discussing having a PPG table at the Bramley Fete in September.
Okay. Yeah,
yeah, and we'll do something at the coffee morning when they ever resume those.
We're planning to start again in September.
Right. Good. Yeah, that makes sense.
But I'll let you know when we decide.
Yeah, sure.
What date and how we're going to do it.
Okay. So AOB, and that is the big question. What do you want from us at the moment, Claire, in the next year?
Well, here's the thing. Kind of thinking about kind of getting back to some kind of normality and revisiting all the kind of aspirations that we had before COVID hit. You know, one of which was the carers. Obviously, we're trying to take that forward now. Very much keen to do something for the veterans as well, because that's kind of tinkering around in my head, thinking, right, okay, from the CQC standpoint, that would look very, very good if we were to kind of push forward with supporting our veterans, maybe having a Veterans Awareness Week. I want to do something about the LGBTQ at some point, and I'd probably visit that in September sometime and have an awareness week for that. Communication definitely is key, and I think, you know, it's working very well with all of you being you know, the communicators, and that's really, really, it's great for me knowing that that's there. Also, literally just around the corner is flu. The flu vaccines will be coming back. So I'm chatting with Margaret at the moment as to how that might work. Very keen to carry on the same model that we did last year. We thought that worked really, really well, and if we can ask you then to get involved with that, with the marshalling especially, that was excellent. Very mindful, obviously, that we may well be delivering flu and COVID boosters potentially. So that's still very much in the planning phase at the moment, but that is something that we would really be keen to harness your help with. So that's that. It's generally those bits and pieces at the moment, and I think that will kind of evolve as we kind of move on out of this sphere that we're in at the moment. And then I think that's just something to kind of maybe just revisit once we're kind of in a little bit more of a state of normality, maybe.
Okay. On the communications front, so you probably gathered Jan's kind of handling all of that stuff now.
Yeah, thank you, Jan.
So the simplest thing is just send anything you've got, send it to Jan.
By
all means, send it to me as well.
Yeah. Okay. Yeah. Well, maybe I'll send it directly to Jan. I'll copy you in so you know what's happening.
Whatever. Yeah. Sure. Yeah. Because we ended up a week or two ago when the two of us both put the same thing on Facebook, and I thought, this is getting silly.
Yeah. Got 1.5 minutes, Keith, and you haven't agreed with me.
Can I just confirm, Jan, that you're happy to put it on the Sherburn St John Facebook as well?
Sue can do that because she's a member of
I'm doing that.
You're doing that.
Yep.
So I don't.
I'll do that.
I can step back from that.
Yep.
Okay. Shall we retire and have a sort of a lay members only short session in sometime in the next few days? Yeah.
Okay.
Yeah. Then we can discuss what we individually are able to do and what we can do, knowing what Claire is going to want us to do. Make sense?
Yeah.
Does.
We haven't
agreed
the last meeting.
Sorry?
We haven't agreed the minutes of the last meeting.
Do we agree the minutes of the last meeting?
Yeah.
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 Yes,
please. I wrote them.
Next date of next.
And
first Friday in
by email because we're going to get locked out any minute.
First Friday in September.
Okay.
Sounds good.
It says, not knowing when it is.
Can I just ask, has Claire had the stuff from Nick about the questions that his question bank, the things he wanted to get views on, asking patients about their access to surgeries and so on? I'm not sure whether it hasn't come up in this agenda, but
no.
Would it make sense